Heaviness in your eyes can be caused by many different factors, ranging from simply not getting enough sleep to more complex underlying issues. This information is for general awareness and should not replace advice from a healthcare professional. Potential common causes of heavy eyes. Insufficient or poor quality sleep, the most frequent cause. Simple fatigue from lack of rest can make your eyes feel weighted down and tired throughout the day. Eye strain, both digital and physical. Prolonged use of digital devices like smartphones and computers, long driving sessions, or detailed work can overuse the small muscles around the eyes, leading to a heavy sensation. Chronic dry eyes. When your eyes don't produce enough tears or the right quality of tears for lubrication, it can lead to dryness, grittiness, and a feeling that your eyes are tired and heavy. This can be worse in dry environments or after long periods without blinking. Allergies. Allergic reactions to pollen, dust, or pet dander can cause inflammation of the eyelids and the eye's surface, resulting in puffiness, watering, and a feeling of heaviness. Anxiety and stress. Persistent mental stress can lead to muscle tension throughout the face and scalp, including around the eyes, making them feel heavy and tired. Less common or more serious considerations. Ptosis, drooping eyelid, a condition where one or both of the upper eyelids droop down more than usual. This is a structural issue and can make the eyes look and feel much heavier. Thyroid problems. Some conditions affecting the thyroid can impact the eye area, leading to inflammation and heaviness. Medication side effects. Some prescription or over-the-counter medications can cause drowsiness, fatigue, or dry eyes as a side effect. Neurological conditions. Although rare, certain conditions affecting the nerves or brain could manifest with feelings of eye fatigue or heaviness. Steps you can take now. Prioritize sleep. Aim for 7 to 9 hours of consistent, good quality sleep. Follow the 20-20-20 rule. To reduce eye strain from screens, every 20 minutes, look at something 20 feet away for at least 20 seconds. Use artificial tears. If dryness might be the cause, lubricating eye drops, artificial tears can provide relief. Optimize your environment. Use humidifiers to add moisture to the air and ensure your screen is at a comfortable distance. When to see a healthcare professional. Schedule an appointment if the heavy feeling persists for more than a few days despite adequate rest. The feeling is accompanied by pain, redness, blurred vision, or eye discharge. You experience a sudden increase in floaters or flashes of light. You notice any swelling or redness of the eyelid. Seek immediate medical attention if you experience sudden severe eye pain, a dramatic loss of vision, a feeling of a curtain coming down over your visual field, a sudden change in the appearance of your eyes or eyelids. To help me give you more relevant information, could you share a bit more? For example, do you get other symptoms like headaches or blurry vision? And how does screen time affect the heaviness?